the urgent thing needs to be to actually get started. We've had report after report. In the dying days of the last government, they released a 10-year plan with no money behind it. What we know is that the health system and the needs of the population have changed a lot since Medicare was designed in the 1960s, but the system itself hasn't changed. We've got to start that process of updating and reinvigorating Medicare and providing a platform for even further changes that are going to be needed down the track.
You know, you say there's a need to actually get started. What came out of the National Cabinet yesterday was the fact that they're going to put it on ice for a little bit now. They're going to deliberate on that report and the recommendations, and then perhaps make a decision on funding in April. How are you reading into that delay?
So the government went into the last election with a commitment of $250 million a year, $750 million all up. And what the minister has said is we are going to announce the details of how we're going to spend that in the budget process. And so what the Commonwealth and states know, or the states know, is the Commonwealth has put that money on the table, and now there's going to be some discussion about what the states might do, and the Commonwealth can say, we're going to actually do these sorts of things, so this is our money. And so there is a bit of fine-tuning, I guess, I'd phrase, to take place over the next couple of months. And it all has to be locked in by budget day. You
mentioned that $750 million that the Labor Party has put aside to try to fix the problem. The issue is that you have also been quoted as saying that it is going to take perhaps over $1 billion and over successive governments to actually fix the fundamental issues that's plaguing Medicare. That being the case, is it a case of no matter how much the money has been slated for fixing the problem, the issue is how it is being effectively channeled? That's the issue?
Yeah, that's absolutely right, Fawzia. But basically, the system at the moment is broken. It's no longer as good as it was. You know, Medicare, I'm a strong supporter of Medicare. I think it works very well. There are problems with it at the moment. There are problems into the long term. And so we've got to say, you know, how are we going to change it to make it more fit for a population which has got a lot of multiple comorbidities, multiple chronic diseases, for example. So we've got to actually say, we've got to put in place new systems and new payment approaches, and then as they are implemented, invest much more into a better system.
Right. You know, in response to the report, of course, and the National Cabinet meeting yesterday, doctors and GPs have felt that they have had a rough ride with the rebates. You say, though, boosting doctors' pay won't actually help the problem here, but you want a focus on the multidisciplinary care. What would that look like? And wouldn't you need more doctors and GPs in order to boost multidisciplinary care?
Yeah, so it's a bit of a both and, Fawzia. So I think we've got to say, if you take the example of low back pain, if you want to get a Medicare rebate for a physio, you have to go to a GP and get what's called a chronic disease management plan, and then you can take that to the physio, and there can be a rebate for a certain number of visits. But in contrast, if we had a truly integrated multidisciplinary team approach, there'd be a physio in the practice, and you could ring up the practice and say, I've got a low back pain, and they would say, well, here, you know, maybe you should be seeing the physio rather than a GP. So it'd be way more efficient. The work, the care you get would be absolutely integrated rather than a separate private practice down the road and so on. So there are efficiencies we can make in the primary care system, which also give better deals for patients.
Stephen, there are many recommendations that have come out of this report. If you could pick one, and I know it's very difficult, if there was one thing that you would like the government to act on immediately after meeting in April, what would it be?
Oh dear, even though it was a 12-page report, there's a lot of stuff in it. I suppose there's changing the balance of attendance funding so that long consultations get more money than short consultations, so you reward a doctor for looking after you holistically. That'd be one of them. Another one would be some sort of encouragement to practices to look after people longitudinally, that is, between visits. At the moment, the GP only gets paid if you're sitting in front of them or on the telephone. But you want them to look after you for the whole year and say, look, our practice is looking after you, and a nurse might ring up between visits. So changing the orientation of the practice, and that's going to take time, but you've got to start it if it's going to be eventually implemented.